An early course of monoclonal antibody therapy may be a component of a plan to eradicate an HIV infection, according to the findings of a small research that was published in Nature Medicine. Antiretroviral therapy is the recommended course of treatment for HIV (ART). ART does not cure HIV, so therapy must be continued for the remainder of a person's life to prevent AIDS and the spread of the virus to others. There are several effective ART combinations available. The majority of clinical studies testing HIV cures, according to Sagard, failed to have any effect on the number of infected cells, referred to as the HIV reservoir, or on the immune system's capacity to regulate the virus. He stated, "In our study, we attempted to intervene just as individuals with newly confirmed HIV infection were commencing ART." He describes how this strategy differs from other research that evaluated interventions on HIV-positive persons who had been taking ART for a long time. 50 men and 5 women living in Denmark and the UK who had recently received an HIV diagnosis served as study participants. They were randomly assigned to receive one of 4 therapies by Sagard and his associates: regular ART, romidspin, a histone deacetylase inhibitor used to treat T-cell lymphoma, 3BNC-117, a monoclonal antibody against HIV, or romidspin, 3BNC-117, and ART. According to Sagard, in our randomized trial, we found that patients receiving potent monoclonal antibodies against the surface of HIV in addition to standard antiretroviral therapy, ART, had a faster decline in the amount of virus in plasma and infected cells as well as a stronger cell-mediated immune responses against the virus compared to those who only received ART. Furthermore, the proportion of individuals capable of partially or totally controlling the virus were reduced when the trial participants stopped ART during a closely monitored treatment break, were much higher among those who had sensitive viruses and received the monoclonal antibodies, than the rest of the study participants. Research has revealed that the immune system, in particular CD8 T cells, is capable of inhibiting HIV replication for many years without ART, Sagard added. It may be possible to lower the amount of virus beyond what can be accomplished with the current standard of care for HIV by undergoing treatment with 3BNC-117, an anti-HIV monoclonal antibody. Additionally, if ART is stopped, this antibody may enhance the immune system's capacity to control the virus. Sagard and his associates published their findings in Nature Medicine. According to Sagard, this is hopefully a step in the right direction, but much more work and modification of the treatment technique are needed before we can ever have a safe, scalable cure for HIV, Sagard claims. In this study, we concentrated on individuals with newly diagnosed HIV, but major priority for future research should be in individuals who have already been on ART for years.